Hello, and welcome to the 2023 Employee Benefits Overview for all full-time hourly employees at ACME Finishing. Let's jump right in and review your 2023 Employee Benefits Package. There are two plans offered at ACME Finishing. Both are PPO plans and both are a $2,000 deductible. First, we are going to talk about the local network PPO, which is an in-network benefit, which has in-network benefits only. So you'll want to make sure that the provider you choose is in the network. This plan will have copays for day-to-day services like office visit copays of $30 or $50 for specialist copays like dermatologists, podiatrists, things of that nature. For larger ticket items, you will have a $2,000 deductible. After you meet your $2,000 deductible, your plan will pay at 80% and you will pay 20% of the bills until you reach your out-of-pocket maximum of $3,500. That $3,500 includes your deductible. Remember that CVS and Walgreens will have the greatest savings for your plan. Mail order is also available for chronic prescriptions. We'll now move on to the next PPO plan. The second PPO plan has a national network. You'll also notice listed here that there are in and out of network benefit deductibles. So let's review the plan. Similar to the first plan, for your day-to-day services, there is a $30 office visit copay. For specialist, there is a $50 office visit copay. For larger ticket items, you will have a $2,000 deductible. If you stay in network, your deductible, after deductible, you will have 100% coinsurance. You will pay copays for things like emergency room and prescriptions until you meet your $3,500 out-of-pocket maximum. After you meet the $3,500 maximum for the year, benefits are covered at 100% and there's no further charge. Remember that deductibles start over January 1st. These are calendar year deductibles and out-of-pocket maximums. Cigna also offers value-added benefits like the Healthy Babies program for expectant mothers. They also have disease management programs for chronic conditions. There is a reward program for healthy living and gym discount information. If you take a healthy assessment, you can also accumulate points, and those points can be used for to purchase other health-related items, weight loss equipment, and things of that nature. There is also a health assistant for those who want to quit smoking or lose weight, help controlling their asthma. All that is available through the MyCigna portal. There is also a useful drug price quoting tool where when you enter the prescription information and the dosage amount, it'll tell you where you could find the cheapest drug near you. Here is a snapshot of the cost per pay for your medical benefits. Please note there are two sets of rates, one for the open access, also known as the National PPO Network, and the other is for the Local Plus PPO Network. These premiums are also per paycheck. Please keep that in mind. These can also be found in your benefit summary. Now I would like to just take a moment to talk about healthcare in general and some money-saving tips. When you go in for your preventative or wellness exam once a year, please let them know that you are there for your preventative visit. If you were to go in and tell the nurse that you have a rash or sore throat, they can also code that visit as diagnostic and treat it like any other office visit. So in order for it to be free of charge to you, no charge, no copays, no deductibles, you need to let them know that you are there for your annual wellness exam. Also, when it comes to prescription drugs, please make sure to talk to your doctor about any free samples they may have. Check out any manufacturer's rebates directly available on their websites. Please note that there are programs out there like GoodRx that have been extremely beneficial to many people with or without insurance. I used it 3 times last year. Also, GoodRx can be used for pet medications as well. And lastly, of course, you want to make sure that if there's a generic that's available that works for you, that you take advantage of those savings. Lastly, there's tests out there, high-cost scans or x-rays, like MRIs, CT scans, that cost 2/3 more at a hospital than at a freestanding imaging center. So when you're needing one of these services, it's helpful to go online and see where you can have one of these services done at a freestanding imaging center opposed to the hospital. We also just want to remind you that you have several avenues of care. Not only do you have your doctor's office available to you or specialist doctor's offices, but you can also utilize convenient care clinics. You'll find those inside CVS or Walgreens facilities. You also have urgent care facilities that are available. They're usually open later than a doctor's office. And of course, for true emergencies, you do have emergency coverage. Now let's talk about the 2 dental plans offered. On the left here, you will see an HMO plan. The HMO plan is unique, that it is copay based. Any type of services needed, you will just look it up and pay the corresponding copay. For example, if you need a crown, you would look up the crown in the set of copays. It's about a 3 to 5 page document. There's various crowns in there. You'll see it's probably about a $350 copay. You would pay your copay and that's it. There's no annual maximums. You want to be careful when finding providers. Sometimes that list can be tricky. Make sure that you verify with the dentist that they do take the dental HMO plan offered through Cigna. The plan on the right is a traditional PPO plan for 100 that covers preventative services like cleanings and x-rays at 100%. It covers basic services like fillings and simple extractions at 80%, and it covers major services like root canals and crowns at 50%. You have an $1,100 annual maximum to use towards your dental services, and this plan also has a $50 copay. Remember that you get more bang for your buck staying in network, so please let myself or Wendy know if you have any questions looking up providers with Cigna. Below are the dental contributions per pay. The HMO contributions are listed here on the left, and the PPO contributions are listed here on the right. These are also available in the benefit summary. Next, let's talk about the vision plan. The vision plan offers an annual eye exam at a $10 copay. If you were to need glasses, your lenses would be covered under a $25 copay, also eligible to be changed out every 12 months. And also there is every 24 months you would be eligible for new frames. The frames have a $130 allowance. Anything above that has a 20% discount. VSP has a very rich list of providers. You should have no difficulty finding a provider near you. Staying in network definitely gets you a lot more bang for your buck. So at all costs, try to stay in network with VSP. It's very easy to do. Also, if you wear contacts in lieu of the frames, you can get contacts every 12 months as well. It's a $130 allowance. And remember, try to stay in network whenever possible. Here are the vision rates per pay. These are also available in the benefits summary. At no cost to you, your employer offers $50,000 one-time salary up to $50,000 in life insurance. They also offer one-time salary up to $50,000 in accidental death and dismemberment. So if someone were to pass away and it was an accident, this policy would pay out twice, two $50,000 policies. Please make sure that your information is updated with the office, your beneficiary information. You don't have to wait until open enrollment to change this. You can change this at any time of the year. Please keep in mind that life insurance does not pay life insurance benefits to whom you're legally bound to. They pay to whom you indicated on your beneficiary form. So please make sure you always keep that information up to date. This benefit is free of charge to you and paid for 100% by the company. If you need additional life insurance, the ACME Finishing also offers voluntary life insurance. For employees, you are eligible for up to $300,000 of life insurance, sold in increments of $10,000. There is a guarantee issue amount of $100,000. Anything over that will require a statement of health. Spouses are eligible for up to $100,000 of coverage. The guarantee issue for spouse is $25,000. And for children, the benefit amounts are either $1,000, $2,000, or $10,000. These are paid for by the employee. This is not an employer-sponsored plan. Now let's talk about the short and long-term disability insurance available through Mutual of Omaha. On the right, you will see that we highlighted here the long-term disability. I like to kind of start with this because this is a free benefit. This is paid for by the company. And although short-term insurance does have, short-term disability insurance does have value, it's very important to note that if you were disabled on a long-term basis, that would really implicate things. So to have company paid for long-term disability insurance is a really, really nice benefit. If you wanted to purchase, you can purchase voluntary short-term insurance. So this is 100% paid for by the employee. After 8 days of either your injury or illness, the short-term benefit will pay 60% of your weekly earnings to a maximum of $600 per week for up to 12 weeks. Remember, short-term disability pays out weekly. If you are disabled beyond the 12 weeks, that claim becomes a long-term disability claim. It will pay out monthly. It'll pay 60% of your earnings to a maximum of $6,000 per month. Depending on the condition, this can pay until you reach Social Security normal retirement age. What are the next steps? If you are a new hire, you are eligible for benefits on the first of the month following 60 days of employment. Once you become eligible for your benefits, please complete your new hire paperwork within 15 to 20 days of your eligibility date and complete and return to Wendy. The statement of health, if you're applying for additional voluntary life insurance that exceeds the guaranteed amount, that statement of health is also available in the HR office. If you do not elect benefits now, you will not be eligible to elect benefits until next open enrollment, which is in February for a March 1st effective date. If you experience a qualifying event, which is something like getting married or divorced or having a baby or adopting a baby, you are eligible to update your benefits. Please do so within 30 days within the HR office. If you have any questions, please see Wendy. Of course, any questions can be referred to Wendy in the HR office, but you may also contact our broker partner at Marsh McLennan Agency, Andrea Aguilar, who is our account executive. Contact information is available here, cell number and email address. If you have any questions you want to ask about the coverage, about providers, deductible credits, anything of that nature. Please let us know if you have any questions. We are always here to help and want you to be happy with the benefits you elect. Thank you.